I'm Shannon Laughlin-Tommaso, Associate Dean for Education, Diversity, Equity, and Inclusion. I'm also a gynecologic surgeon in the Department of OBGYN. I'm so excited to be here today to talk about getting to the heart of inclusion, pathways for workforce diversity. Today I'm going to be highlighting some of the values of pathway programs, and including the importance of mentorship and on-campus experience for students that we are recruiting in. And then we're going to talk about retention and sustainability, including exploring opportunities for curriculum development in partnership with learners to build a more inclusive learning environment. First of all, let's start talking about pathways. We have many pathway programs because about 20% of our college end up on staff at Mayo Clinic. So our early investments in attracting and retaining the best and brightest student pays off. We feel that it's important to make that investment for the long run, and we have to start early. We have over 20 pathway programs through the Office for Education, Diversity, Equity, and Inclusion, which we call ODE. I'm only going to highlight a portion of these, but really I want to give you an overview of the key opportunities that cater to the grade level of the students and the needs of our students. And there are a variety of pathways to bring students to each of our schools through the College of Medicine and Science across the healthcare spectrum. And just a couple notes, I'm going to be showing a lot of pictures today. All the pictures were done pre-COVID or in COVID-safe ways, and all of the students have given permission for those pictures. There's a lot of power in providing a spectrum of opportunities to students, many of whom may only know about the nursing and doctor pathways, but they really could be a caregiver at heart, but just not want a clinical job. And there are many non-clinical jobs available in healthcare, including legal, administration, education, engineering, biostatistics, and artificial intelligence, and more. One of our programs, the Mayo Clinic Cares Arizona program, offers high school students an opportunity to come on campus or come virtually and get to meet people throughout the spectrum of healthcare, in addition to nurses and doctors. Our second program that does this really nicely is the Native American Pathway Program, which I'll talk about in a minute. The second value when you're considering creating pathway programs is to help students navigate the transitions. And this is really important for undergraduate students who are considering going to medical school or graduate school. The Undergraduate Plumber Scholars Program, which is featured here, offers students webinars during their academic year on such things as MCAT prep, summer research opportunities, the medical student experience, and how to apply and interview for medical school. The students also get near-peer mentorship by current medical students, which really helps them understand the ups and downs of medical training. In addition, there's a summer intensive program, which is important for getting students on campus and for getting them the research opportunities, which I'm going to discuss in a few minutes. In addition to similar programming that the UPS program offers, our Native American Pathway program does some virtual simulation for the students to really experience patient care, even virtually. The Native American Pathway program is open to American Indian and Alaska Native persons and those having origins in the original people of North and South America, or anyone who's demonstrated a commitment to American Indian or Alaska Native communities, and also maintain a tribal affiliation or community involvement. The next opportunity is for research opportunities for medical students and graduate school. One of the things that can make it tougher to get into the biomedical sciences and healthcare fields is demonstrating a commitment to research or to learning when you may not have those opportunities at your local school. So we provide resources for under-resourced schools. The students come on campus and can participate in clinical, preclinical, and basic science research. And we've partnered with a couple of HBCUs for this opportunity and to provide those resources. One of the opportunities is the Mayo Clinic Dean Scholars Summer Research Fellowship Program, which is a partnership with Meharry Medical College. In addition, the Mayo Clinic Summer Research Fellowship Program reaches out to other HBCUs such as Howard and Morehouse. And then we have a Summer Undergraduate Research Fellowship, which really leans towards the graduate school and really trains students who are interested in going on to graduate school as their next step. The next value is really the value of the experience. And I put Mayo in brackets here because that's our experience, but students would want to be on campus to experience your school too. So the value of the Mayo experience is the students get to come and see that we really live by our primary value, which is the needs of the patient come first. And our Rural Scholars program, even though they come for just a few days out of the year, they get to see what it would be like to see themselves here at Mayo Clinic. For longer opportunities, we offer a 4-week clerkship for visiting medical students. So we have a broad array of elective clinical rotations that foster growth of medical knowledge through direct patient care experiences. But we also recognize that coming on campus is not without cost. And so we offer a diversity scholarship to make sure that students who are committed to advancing equity and diversity in healthcare can have the same opportunities. And part of that program, the scholarship recipients also get to meet with program director and residents as well as the O-Day directors and leadership. And lastly, and maybe the most important value in pathway programs is mentorship. And we offer a lot of different mentoring along the way. As I mentioned, near-peer mentoring previously. We also have career advising. But one of the opportunities that we also offer is diversity mentoring. So sometimes it's hard to see yourself in a future career where you haven't seen people that look like you or have similar aspects of diversity. And so we have both an internal and an external program. The external program is called the Wilson Scholars and is available to medical students from other institutions. Our medical students can also participate in diversity mentorship program where they can select an aspect of diversity that they would like more mentoring on, and we pair them with faculty here. Now let's turn to retention and sustainability. To really have sustainability and to retain our students, we need to make sure they feel included in the learning environment. So we assess that with a college-wide diversity and learning climate survey. The climate survey has been shared with all of the learners on the campus. And I'll just share a little piece of the data that we got out of this. We surveyed over 3,100 students, and we distributed it to all enterprise learners in the 5 schools across the college. We had over 1,700 learners that completed it, and 620 identified as non-white. One of the areas of questioning that we had was about our diversity, equity, and inclusion climate. And we found that about 63% of the students found this to be favorable. What was interesting is this is a significant predictor of the likelihood to accept a job at Mayo Clinic, of which about 79% of learners would accept a job if they were offered one. And so it just shows you the value of really creating a diverse and inclusive environment. And to do that, we also took some of the results of the survey, both the quantitative and the qualitative results. We divided them up by each school, and we were able to create curriculum that works for each school. And this really came about in partnership with our learners. After the murder of George Floyd, our learners wrote a petition of which about 192 medical students signed and asked us to create anti-racism curriculum. By creating this inclusive learning environment, we allowed our students' voices to be heard, and it allows for better understanding for all, for health inequities, and to stand up for each other. So we created, and we continue to create, the IDARE curriculum, which stands for Inclusion, Diversity, Anti-Racism, and Equity. And we built it off this socio-ecological model in which you can see the inner ring is personal. And so the first thing we teach about is unconscious bias. And then as we go out in the rings, we look at interpersonal biases, and we teach about microaggressions and upstander training so that people can learn to use the words to speak up. In the institutional ring, we always think about things like patient bias, and we learn about the rights of our patients, but also the rights of our learners and our faculty. And we do a lot of faculty training on all of these topics as well, so that they are able to support our learners in every way that they can. The last ring is society. Our students live in the community, and they're going to go out into society after they finish their training here. And so we really teach about the historical perspectives of systemic racism and the effects that it has today on health inequities. As I mentioned, we continue to work on this. These are just some of the topics that we've already included in our IDARE training. And as you can see, these offer the opportunity to have everyone get to use a common language, give people the words to speak up, and then they can understand bias and racism at a deeper level, which translates to understanding social determinants of health and improving health inequities. So we continue to work with our learners and to get feedback. One of the keys in this also is small group learning, where people get to actually practice and have hands-on experience. So in summary, there's a lot of steps on the pathway for workforce diversity, and I just highlight some of them into going into the healthcare fields. Under recruitment, remember, you always want to start early and be planning for a long investment. Offer a broad spectrum of healthcare careers, not just nursing and doctors. Navigate the career transitions, including career advising. Offer some resources that they may not have locally, such as research, and on-campus experience is very valuable. Lastly, I cannot stress enough the importance of mentorship. And then once the students are on campus, think about retention and sustainability. Do you know your climate? Have you developed curriculum that can speak to the students and that student voices can be heard? And then focus on the self and work outwards and thinking about that model. Thank you so much for listening.